Hello, my name is Beth, and I'm a registered nurse with NurseLine. What is your name?
Hi, I'm Susan Hannick.
Hi, Susan. Are you calling about yourself today?
Yes, I am.
Okay, Susan. Let me pull up your record. Could you spell your last name for me, please?
Yes, that's Hannick. Hanich.
Thanks. Can you please verify your date of birth?
It's June 7th, 1947.
Great. How can I help you today, Susan?
Well, I've noticed that I have a ringing in my ears, and I'm not sure if it's something I need to worry about.
Do you have any other symptoms?
No, I don't. I noticed it this morning when I turned off the radio, and I could still hear this ringing in my ears.
So your main concern is about the ringing in your ear that you noticed this morning.
Yes, that's right.
I can go over some questions with you to help you figure out whether you need to do anything about this ringing in your ear. Sometimes this is called tinnitus. Does that sound okay?
Sure.
I always like to remind folks that this information is not a substitute for your doctor's advice. Does that make sense?
Yes, it does.
Okay. There are some health risks that affect how you may react to a symptom. These are things like your age and overall health, medications you take, recent events like an injury or surgery, and your general health habits. Any of these can cause a symptom or make it worse.
Okay.
Is there anything you can think of that may be a health risk for you?
Not really.
Now, I want to check if you have any other problems than ringing in your ears. Did the symptoms start after a head injury?
No.
Do you think you may have an ear infection? Pain and discharge from the ear are the usual symptoms of an ear infection.
No, I don't.
Okay, the next question is about the most serious things that can occur with ringing in your ears. So I need to ask if you have any symptoms of a stroke. Symptoms of stroke may include sudden numbness, tingling, weakness, or paralysis in your face, arm, or leg, especially on only one side of your body.
No, nothing like that.
Okay, how about any of these? Sudden vision changes or trouble speaking, sudden confusion or trouble understanding simple statements, sudden problems with walking or balance, or a sudden severe headache that is different from past headaches.
No, nothing like that.
Good. Have you had an injury to your ear in the past 2 weeks? Something like a direct hit or a very loud noise or something stuck in your ear?
No.
I need to ask you about vertigo, which is the feeling that you or your surroundings are moving when there's actually no movement. It may feel like spinning, whirling, or tilting. Vertigo may make you sick to your stomach, and you may have trouble standing, walking, or keeping your balance. So, do you have vertigo?
No, I've never had that.
Do you have any new hearing loss?
Not really.
Is the ringing in the ears a new symptom?
Yes, it is. I can't remember having this before.
Are you nauseated or vomiting?
No, I'm not.
Did it start suddenly?
Yes, just this morning.
Is the ringing only in one ear?
Yes, it's in my left ear.
Well, Susan, based on your answers, you may need to seek care soon.
Oh, really?
Yes, there are a couple of reasons why. The fact that you have the ringing in one ear and that it began suddenly are the reasons why you should call your doctor or go in to be seen today.
Why? What could it be?
Well, I'm not here to diagnose, but to help with figuring out how serious any symptom is. A new symptom in just one ear is one of those things that should be checked. Do you have a doctor or health professional that you normally see?
Yes, I see a nurse practitioner, Amy Reynolds.
Can you give her a call today or go in to be seen?
I'll go ahead and call her office. Actually, I feel better about having her look at it since it just started out of the blue.
Okay, that sounds like a good plan. Susan, what were you thinking you would do before you called NurseLine?
Well, I was starting to get a little worried when I called, so I probably would have ended up going in to see Amy. But this helped me feel like I wasn't off track.
I'm glad I could help. Do you have any other questions?
No thanks.
Well, good luck with your visit. If your symptoms get worse or you are concerned before then, you can always call Amy.
I will. Thanks.
All right, take care, Susan, and feel free to call anytime you have a concern.
Thanks very much for your help.